Sacroiliitis. Sacroiliitis is an inflammation of one or both sacroiliac joints. Sacroiliitis is an inflammation of one or both sacroiliac joints and a common cause of buttocks or lower back pain. Sacroiliitis can be a manifestation of a wide range of disease processes. Symptoms of sacroiliitis can vary. People with sacroiliitis commonly present with ipsilateral or bilateral buttock and or midline lower lumbar area pain. Up to 50% may have pain radiating to the lower extremity. Conventional radiography remains the first line of imaging despite its poor sensitivity and specificity in early disease. Specific sacroiliac joint views are helpful in the evaluation and comparing both sides of sacroiliac joints. Radiograph findings include sclerosis of the end plates, particularly on the iliac side, irregular joint end plates, and widening of joint spaces. So the radiographic features of sacroiliitis include sclerosis of the end plates, particularly on the iliac side, irregular joint end plates, and widening of joint spaces. CT examinations offer greater sensitivity, accuracy, and detailed information compared to the plain radiography. However, due to higher radiation exposure, it is not advisable to use CT for diagnosis or follow-up purposes. Bone scans demonstrate increased radioisotope activity of the joints and helpful in localizing the source of the pain. It is also valuable in excluding stress fractures and other bone pathologies. Though not routinely used for evaluating the sacroiliac joints, MRI is capable of identifying early inflammatory changes of joints when other imaging is negative and excludes other differential diagnosis causes such as disc prolapse, which may resemble clinical symptoms of sacroiliitis. MRI features of sacroiliitis can be divided into inflammatory and structural lesions. Inflammatory lesions include marrow edema, first to appear, high signal on water-sensitive sequences. The next one is synovitis and capsulitis. It's a thickening and contrast enhancement of the synovium and joint capsule. Enthesitis. This is the thickening and contrast enhancement of ligaments and tendons at their attachments to bone. Structural lesions include subchondral sclerosis. Subchondral sclerosis are bands of low signal on all sequences paralleling the joint margins at least 5 mm from the joint space. Erosions. Erosions are marginal foci of articular bone loss, and erosions are low on T1 and high on T2 and stir signal if active, and more prominent anterior-inferiorly and on the iliac side of the sacroiliac joint. When confluent, erosions may appear as joint space widening. Backfill. Backfill is an intra-articular high T1 signal filling up excavated bone erosions. Backfill is intra-articular high T1 signal filling up excavated bone erosions. Fat metaplasia is periarticular fat deposition and ankylosis. Treatment depends on the underlying cause of the sacroiliitis. Physiotherapy may also be helpful in strengthening the pelvic muscles and increase the mobilization of the sacroiliac joints. Analgesics, such as non-specific anti-inflammatory drugs, may be helpful and useful in symptomatic management. Surgical fusion of sacroiliac joint is only considered as a last resort when conservative management is ineffective. The following conditions may mimic sacroiliitis: hyperparathyroidism, This is not true sacroiliitis, but mimics its appearance. And then osteitis condensans iliae. This is a benign sclerosis on the iliac side of the joint.